So I did a study on what people on TikTok were saying about cycle syncing. Now, because research takes forever to publish, these data were from 2023. So they have really added a lot to the trend since then. But what we found was that they were making specific exercise and nutrition recommendations during each of the four menstrual cycle phases.
Hmm.
The interesting thing about the nutrition piece for me, and I'm not, again, I'm not a medical professional, I'm not a dietitian, but I can read. And I have noticed that there are things that are recommended in the dietetics literature that are not consistent with some of the things cycle syncing recommends.
Welcome to the Wealth Podcast, Off With Your Coat, a podcast on women's health and wellness where we flip the script and ditch the surface level chatter. We need to ask the real questions. Let's get back to storytelling and back to basics to help us uncover how to set ourselves up for true health and wellness and pass it on. I'm Kat Duff, founder of GenWell, the women's health advocacy brand building wealth, the intersection of health and wellness. Some days it's me and a doctor, coat off, talking about what really matters. No fluff, no filters. Other days, it's East meets West, trading tools, not punches, to help move women's health forward. We're building generational wealth. Come with us. Coats off, let's go. So our guest today is Dr. Emily Pfender. Hi, Emily. She is a health scientist and a social media researcher who has been all over Instagram, just sharing all of her interesting research across all of women's health. And I'm very excited for you to be here today on Off With Your Coat. Do you want to give us a quick intro?
Sure. So I'm a postdoctoral researcher in the Department of Obstetrics and Gynecology at the University of Pennsylvania. And my primary area of research is examining specifically women's health and wellness trends on social media, and then testing how messages embedded in those trends actually impact attitudes, behaviors, and intentions in terms of health decision making.
That's incredible. So I guess off the bat, is you're thinking about your background, your sort of career trajectory. What we like to do here with Your Coat is sort of go through your background. So obviously you're a female, you've gone through maybe some natural medicine, mainly allopathic medicine. I'd love to hear a little bit about your experience in women's health from a patient standpoint.
Okay. So in terms of what I've experienced as a patient throughout my lifetime.
Yeah. So have you had any sort of negative health outcomes or just situations where you were trying to navigate the system or find different voices to help you through? Because ultimately, we find women, we don't know about our bodies, and we're trying to look for anything and everything to empower us and to sort of give us hope, and that we're understanding how we can have longevity and health in the future. And I think we have to sort of take a step back and look at our health history and where we've sort of come from, and the experiences in the past that are shaping either our trust or mistrust in doctors, medical system, why we are, looking to social media, why we're looking to AI. So I'd love to just know if there's anything in your background that sort of either led you into this area of research or just, from a personal interest level.
Absolutely. So there's one really life-changing health experience that I had as a woman where I had a hip injury. It wasn't something that it just suddenly came on, and it wasn't something that was caused by trauma or impact. It was just something that was working over time. And so in March of 2022, I started seeing doctors for severe hip pain. And ultimately, what happened was that I was not believed that anything was wrong for 8 months. And so for 8 months, I was living in severe chronic pain. It got to a point where I my husband and I had to make sure that we were parking close enough when we were at a restaurant or the grocery store to the building, because walking any distance at all was just absolutely excruciating. I stopped walking altogether. If anyone knows me from social media, I post my steppies every day with my dog. I'm out there doing an hour every single day. It's very important to me. I wasn't walking at all. I lost my ability to strength train. The only thing that I could do was actually swim. That was the only thing that didn't increase the pain or further aggravate it. And so 8 months into the journey, I finally came across a physician who believed me, who ordered the right tests, which I asked for because I was chronically searching social media for people with the same experience. And so I got the idea about the test that I needed from YouTube. And he actually ordered it, and we found out that I had a massive hip labral tear, which is the cartilage around the hip. It was torn from 9 to 2 o'clock, which is pretty much the
Wow.
whole way. And I saw more doctors, and we found that I actually had an abnormally shaped femur bone, and that's what was cutting holes in my cartilage. And so it could have been something that developed over time or something I was born with, but it was completely out of my control. So I ended up having a hip surgery after finding a surgeon that would do it, and spent a year in physical therapy after that recovering. And so that was probably my first major incident where I felt like because I was a woman, I wasn't believed. I honestly started telling physicians that at the time I was a PhD student working in the health space. And it was so interesting. Once I started saying that, they would write in the notes, really kind and warm PhD student presents with. And so it was really funny that, I mean, it's unfortunate. I mean, it's unfortunate because it's one of those things that it's like I had to pull every string to be believed. And that was a string that I eventually ended up pulling. It was a very most difficult thing I've ever been through in my life. And I do believe that it being tied to the hips and being more of like a predominantly female issue, this injury is more common in women, had something to do with it. And I'm still working through as a result of the surgery. I actually haven't talked about this before, but I'm not ashamed of it. Still working through secondary gynecological issues as a result of the surgery itself, which I've been working through since I got the surgery. So here we are 2 years later, and I'm still trying to find physicians that believe there's now a secondary issue related to it. But now that I work in a department of obstetrics and gynecology, I'm finally being linked up with physicians that, being a postdoc in that department, they're going to believe me and take me more seriously. But I think this is a really good example of how, like, what does it take to be believed? So that's kind of my background and my story with it all.
Yeah. And out of those physicians in like the first phase of that, were they predominantly female? Was it a mix of male, female physicians that you had seen that weren't believing you?
They were all male.
They were all male.
And my surgeon was male too, and he believed me right away.
Yeah.
He saw the MRI and was like, "Holy shit." Like, he's
Yeah.
like, This is not going to improve unless you get the surgery," was what he told me,
Wow.
and he was
I mean,
excellent.
it's just wild that for anyone, but women specifically, that it still is taking us that long to get to outcomes that are actually moving us forward. And you're in such an amazing, lucky position that you are where you are and you have access to that. And so many women do not. Do you have any sort of thoughts on, if a woman was going through that situation now, any sort of tips on how to navigate the system without having those, sort of strings to pull?
So what I would lean on, though I will explain how it's also kind of a privileged position, is to not give up. If you don't like someone's answer and they're not hearing you, go find someone else. Someone
Right.
else will listen. I went through 4 physicians until I found one that would do the correct imaging to find out what was going on. However, I have excellent health insurance. I can see as many specialists as I want. There are many people who are on health insurance plans that you get one opinion,
Hmm.
and that's what it is. And so there's still a little privilege in that answer. I mean, I don't even know if people know that, you should be going to these physicians like Google Scholar. Like, that's what I did. I was searching physicians in my area and looking at, are they actively working in this and publishing studies based on patients in their facilities about this exact issue that I'm experiencing? Like, I want the best of the best. I want the person that is doing this surgery every day and scientifically like publishing on it as well, which not all surgeons do that. Some do, some don't. But that's what I was looking for, and that's what I found.
That's such a great takeaway. Is Google Scholar something that anyone can go to? Do you have to sign up for it? Is there a fee?
No fee, it's free.
Okay, that's amazing. I have a question about Up to Date. Is that something that you think is a good source for folks? I know myself and a few other friends in the area, we've had clinicians that will, if they don't know something, they'll send like, here's what the Up to Date research says. And so it is like the most current peer reviewed research, but Was just curious if you had any thoughts or you were familiar with it.
I've actually never used it, so I don't have any
Yeah.
thoughts, but it does seem like a good resource.
Yeah, I'll link it in the show notes as well because I think that just having those 2 accessibility points sounds amazing. It's just I think from a just like a navigation standpoint for us, it's like you have to be the squeaky wheel. You have to constantly ask why, but it also starts with us. Like we are 100% in control of our own health. And now we have so many voices and so many different opinions. It gets so confusing. And I know that you're doing an amazing job on social media, sort of sifting through the bullshit and getting to like one point. It's like, here's a takeaway that the research or the science is saying right now and making it, actionable, digestible for women. Bravo to you because that is freaking awesome.
Thank you.
Are there, how has your experience been just in that process of like building your social media presence, choosing, which research to present and how to present it?
Yeah, so I'm pretty careful about what research I present. I pretty much stick to wellness trends that I analyze on social media and talk about how they're either evidenced or non-evidence based and the strategies people use to convince you that they're true. So I primarily focus on that. I have a whole other body of research that I don't share on social media because the backlash is too extreme. So a lot of people don't know this, but I do a lot of behavioral vaccine research as well. So predictions why people do or do not take up vaccines. And I don't talk about any of that online because the trolling is too severe. And I just like they'll bully me. And
Mhm.
I just don't wanna deal with it. And so there's a whole body of research that I don't share, which, I mean, I guess the public's missing out on that, but there really is you know, a give and take, and I'm only willing to take on so much negative backlash from the public before it's not worth it for me to share the science.
Yeah. Ugh, that's so frustrating. I mean, is there in your mind a safe space to share information, to share something that you've been studying where it would be helpful to women specifically? Like, is there a way to disseminate that information?
For me, if it's something really charged like vaccines, no, it's not worth
Yeah.
it for me.
Yeah.
But I'm happy to share it in conference settings where I'm not gonna get torn up by my colleagues. But unfortunately, there are just some topics that I mean, there are tons of creators who talk about vaccine research. I'm just not willing to do that.
Yeah. I completely understand that. So, what are you working on currently? Is there any research you're really excited about?
Yes. I'm currently doing some work around developing a way to measure in perceived influencer authenticity and credibility. So oftentimes we conflate those two terms, and I'm trying to show like statistically and empirically that those are two different things that are influencing how we absorb and think about influencer health content. And so it's so funny. I have all my followers taking it right now. I think 100 people took it thus far. We just
Cool.
we just posted it last week. But it's going to be a really good way for people to have this tool to measure the psychological and cognitive processes around how we process influencer health messaging. Like, what are the factors that make us believe them? So when we think about source credibility, we think about things like their attractiveness, their
Mhm.
perceived expertise, and their perceived trustworthiness.
Mhm.
What are the things that are making those 3 items salient for us? And then I'm trying to establish that authenticity is different from that, right? So how much we perceive them to be real, authentic, relatable,
Mhm.
and that's different from some of the other words that I talked about. And so we're working on that, and that's gonna really help us understand, like, why are people trusting non-credible sources?
Mhm.
And do they think that they're experts? And if so, why is expertise not related to credentials anymore?
I mean, it's loaded, right? For me, I find that, I don't have any credential background. I'm just a regular gal going on social media trying to get my information. But I think different than some, I really like to lean into all of my points of view. So I have, you know, various different doctors that I know that I can go to. I have trusted sources that I've deemed trusted on social media because some have backgrounds, some don't. Some aren't credentialed.
Yeah.
Some share their lived experience, which I think is important. But I also am empowering myself to try to navigate the research as best as I can to support something. So never just like believing someone based on the first thing that they say, if that makes sense. But it's a wild world out there.
Yeah. No, what you bring up about lived experience is really important because when in the measure that we're assessing, we're dividing expertise into like like medical or scientific credentials, but also what we call embodied knowledge. So someone who experiences some like a medical diagnosis or health related incident does have a certain degree of expertise in that. It's just that what we see the issue is that they then talk about it as if it's absolute and everyone will experience it in that way. It's
Hmm.
kind of like the what I eat in a day videos, how people watch them and think if I eat like this person, I'll look like them.
Yeah.
It's like a major fallacy that we see. And so it's all very important and also very difficult to kind of tease out.
Yeah. And we talk about that all the time, right? It's like, where's the nuance?
Yeah.
And to your point, it works with the embodied knowledge as well as, you know, uh, in my opinion, the research studies as well. Like there's some studies that are being put out there on social media where it's not being shared that they have a sample size of 13 women versus, I think the minimum is what, 300 in terms of like you can give me the quick and dirty on that.
It depends on how many conditions you have in the study, and it depends on what type of research you're doing. A lot of the time, if I'm doing, like, survey research, like, I mean, I would prefer to have 2 to 300 if I'm trying to draw, like, a significant claim, but, yeah, like, if I did a social science study and, like, a survey on 13 people, it wouldn't get published. Like, it just wouldn't.
So do people actually get that published and peer reviewed?
In medical studies, yes.
And so are influencers or doctors, are they sharing that information with the public, or they're just sort of coming out with the claim of saying, "Oh, this is what, women are doing or not doing." So for example, the recent study where everyone is trying to figure out how much women should be lifting. We sh
Yeah.
we weren't supposed to lift for so long because like, we can't get bulky, and now everyone's like, "You gotta fucking lift. You gotta eat your protein. You gotta get your weighted vest, but don't do it because now your bone density is gonna be compromised." And it's this, like, cycle where we're so lost, and so how do you drill down on finding those resources? Is there anything that you can help us sort of as someone who is not in that background, looking at a study and saying, "Okay, this is realistic, this is accurate, this is Bible, this is truth," versus, okay, this is maybe manipulated or this is not an appropriate study with like the right amount of human studies or something like that.
You should always go to the last section of the paper and read the limitations.
Okay, that's a great point.
Always look at the limitations. In every study I do, I some of my studies are racially diverse and have the quota for matching the US Census Bureau for
Mhm, mhm.
racial groups and ethnic groups in the United States or wherever I'm doing the study. But in a lot of my research you'll see in the limitations could be more diverse, could be more generalizable, could represent a larger group of Americans. The other thing that I'll always do is I think most Americans and people don't know the difference between observational and experimental research. And observational is usually based in correlations
Mhm,
versus experimental. We can make causal claims like this caused this, the effect was this. And so in most of my studies, because I tend to do more like content analysis, observational work, in my limitation section, I will say the information just provides us descriptive information about what's going on social media. None of this is causal. I cannot draw causal claims based on this
mhm,
study.
mhm,
If someone's claiming cause and effect, they had to have done an experiment and there should have been like a manipulation and a control group.
mhm,
Everything I just said is probably still like a lot for people to process. But I think that the main takeaway is that you should go to the limitations and read how the study was flawed because the authors will tell you.
mhm. Okay, that's really helpful. How, let's say, can a study still be a strong study even if it was flawed? Because I would say most studies are flawed in some way, right?
Yeah, they're all flawed, for sure.
Yeah.
They all have limitations and flaws. It can absolutely be a strong study still. It's just that we need to interpret it with healthy skepticism.
Okay. Okay. As with all things, right? How then can we look at sort of, you were saying the diversity piece. How are we moving forward, as a culture in terms of like creating inclusive health models for women's health studies?
I think that all boils down to, like, the sample. Like, a lot of my especially my, like, social media content analysis work where I'm analyzing trends. Like, one of the issues I run into is that the creators that say I pull 1,000 TikToks and analyze them. I can't really say for certain what the racial and ethnic background is of the creator.
Right.
So I'm in a position where I'm either having to guess and claim that as fact in my study, which is not great. Or, I search them and look them up and try to find the information online, which is possible. Or I look at their hashtags. A lot of creators will identify their like race or ethnicity in the hashtags. I've seen that.
Okay.
But it's not like widely publicly available information. And so, a lot of the work that I do, I can't really add that racial and ethnic nuance.
Hmm.
And so it's just like another limitation, I would say. But at my postdoc, we're doing a lot of work on Black and Indigenous maternal health.
Hmm.
And so we're specifically looking at those groups of people and that population. And so there are a lot of people doing work like that. But
Yeah.
it's challenging and it's hard to recruit those people as well.
Can you tell us a little bit more about that, your postdoc study?
It's tough. I work at a center at Penn that advises other centers at medical schools across the United States. And so we're providing information to them about how to use something that we call implementation science to improve research. And implementation science basically says that, unfortunately, on average, when we find a medical intervention, on average, it takes 17 years to implement it in medicine.
Holy shit.
Yeah, and so we're trying to close that gap in maternal health because Black and Indigenous women are 3 times more likely compared to white women to die from maternal mortality or morbidity. And that's in the United States specifically. And so we're trying to use implementation science to say like, "Hey, we have these interventions. Some of them have been shown to be effective. How can we actually them in medical settings?"
It's incredible. And when, hopefully not 17 years, but when will you have sort of your learnings from that project?
Hopefully, we'll see that in the next year or so.
Okay, great. And then just to take one step back, a big step back, in terms of women's health research in general, can you give us sort of like a brief history on women's health research and kind of where we are now? I know women weren't added to research until 1993, but we still have a lot of momentum that we've sort of made up for in recent times. So I love your perspective on like where we were, where we are now, and like kind of where that urgent action is for women right now.
Okay, so I looked it up because people online were saying that like 1% of funding goes to women's health research. And I looked it up, and in 2023, the National Institute of Health, NIH, 7% of the funding, it was 7 or 8% of the funding went to women's health research
Okay.
specifically, which is pretty dismal still. Like, I know people on social media were saying like 1%. And here I am saying, no, it was actually 7 or 8%, which is like no better, right? Like hardly better. So I'd say
That's
it's still
wild.
yeah, it's still a significant issue. I'm not fully aware of how they break down what it means to be in the category of women's health research. I wonder if that's like, I'd have to look that up. I wonder if that's like conditions only affecting women, right? Because we have conditions that affect men and women
Mhm, mhm.
and they're studied, but was that 7 or 8% just conditions affecting women like PCOS,
Right,
endometriosis, that kind of thing?
right. Even more dismal.
Even more dismal. So I would say that's definitely an issue. What I would add to that though is, and I just wrote a reel. I didn't film it yet, but I wrote a reel about this morning when I was
Little
having my
sneak peek.
coffee.
I love it.
Yeah, I think that that is weaponized online for influencers to charge the situation emotionally and say, like, this percentage of health funding goes to women's health research, and then be like, and I have a natural, like, other alternative way for you to deal with that condition because researchers don't care about you and physicians don't care about you and aren't given funding and time to take care of you. And so here's, my $500 program. And so I do think that it's weaponized by content creators online, and by people who have no idea what they're talking about. So, and I would also add that I feel like my generation is more interested in specifically focusing on women's health issues. And so I think that more people are creating, grant proposals and study ideas to specifically work on building knowledge about women. And so I do think that those things are changing. Not to mention, like, there's a lot of, grant calls that are coming out that are about women's health. I just reviewed a bunch of grants for the Society for Family Planning, and all of the grants were on contraception and misinformation. And
Awesome.
so the more calls that we have for grants about women's health, the better, because one of those or two of those or however many will be funded. And so
Right.
there's also a need for a change in, like, what grant opportunities are out there, right? And we're seeing some of that.
Are there ways that just women in general can help support women's health research? Like, are there places for us to go to be able to support specific studies or anything of that nature?
Yeah. We need participants. So, like, when you are diagnosed with a condition, it does help for you to participate in the research that's trying to find solutions to your issue.
Hmm.
And yet we see a lot of people who are so hesitant to participate in research, and, like, honestly, a lot of it's paid. Like, there
So,
are good opportunities to earn money doing this.
yeah. Can you talk a little bit about like what someone's experience might be? Because my like visceral reaction to that is, oh, they're gonna put me on a pharmaceutical that like maybe I don't want to be on or I don't want to test out, or you're sort of forced into something rather than having that collaborative care that we really should strive for. Is there like a sort of a quick and dirty on like, okay, if you sign up for a study to help women's health move forward, this is what it might look like?
I don't do any specific biomedical research, like medication, anything like that. So I can't speak to any of that research. What I can say, like, my work is all on social science, and so it's about, like, attitudes, behaviors, intentions to perform certain health behaviors, and that kind of research you can find online, and it's done, like, from your phone in your home.
That
And
sounds
so
easy enough.
yeah, there's no, like, medications. I can't speak to clinical trials or anything like that. I do believe that they're important, and I do believe that the informed consent process is, like, strong. Like, you're never going, like, it in every human subject's consent process that I have, at least for my own research, like, it is clearly communicated to people that if at any point this study does not work for you, you can remove yourself without consequence.
Okay, you can tap out. I'm done. I'm moving on.
For human subjects, that's all required, yeah. So, if women are afraid and think that they don't have autonomy in the study to remove themselves from it, like, I would just say that know that you're always in control. Like, you can always choose to not participate if you don't want to.
Yeah, I think that's a great message for women's health in general. You are in control. You have the ability to make your own decisions. No one is telling you, no one is forcing your hand. But with that comes a lot of responsibility. You need to sift through all of this bullshit. And we'll get to the bullshit in a second, which I know that you love diving into in the misinformation. But I think one and last question that I do have as you were talking about the natural medicine space, because our listeners, are interested in both sort of the natural, like holistic space and, traditional medicine. And I think there is a place for sort of trying everything within reason. Um, and finding what works for you as an individual, like within your nuance, right? And so, because a lot of the ancestral, traditional methods, if you're looking at acupuncture, all these things, like there are some studies out there. I wouldn't say there's a tremendous amount of studies on the natural side, maybe peer reviewed studies. And so, How do you, as an individual, if you're looking at yourself as like Emily Fender taking your white coat off for a moment, how do you kind of sift through what sort of something that you would try versus something that you're like, okay, this person is like claiming something that could not be true? Like, how do you sift through that as an individual?
That's tough. Do you mean online or in person or both?
I think both.
So I think that you want to ask yourself, like, is this person actually like certified to the highest degree that they can be in offering this medical advice? And are they actively like seeing patients? And do they have patients improving? That would be a question that I would have. I definitely got wrapped up in because of how desperate I was during the 8 months of living in severe chronic pain with my hip and not having any answers, and honestly thinking that the rest of my life was going to be like that, like, that's where I was mentally. Like, I didn't see hope like, after a certain point, I was like, I could be like this the rest of my life.
Hmm.
I'm willing to try anything. And I think that a lot of people get to that point when they're experiencing a health crisis like I was, and they'll start trying anything. And I think that's how a lot of people get sucked into this sometimes. I got sucked into, I mean, I I was just so desperate that I was willing to do anything. I bought supplements that people said were good for hip pain and cartilage and that kind of stuff. And none of it was worth the money. None of it was actually effective. None of it was actually, like, tested. I mean, our supplements are not, like, they're not even FDA approved. Like, you know what I mean? I mean, they're not regulated. And so that kinda stuff is just, in my opinion, not worth spending your money on. But I don't know, does that answer, like, some of the question? Like, I will say that I'm very skeptical of some of the more natural methods because of the way they're weaponized online
Hmm.
and targeted toward, like, people who are very desperate to heal, if that makes
Hmm.
sense.
Yeah, I think that is a good segue to social media in general. I think, especially for women, we are desperate to learn about our bodies because we weren't taught that. And I'm with Genoel. We're so excited to help the next generations learn about their bodies and their cycles and how to be proactive with their health. But sort of as I've been building this, I'm like, I don't fucking know. We don't know about our bodies. We weren't taught that. And now we're playing catch up and we're sort of grasping at straws. And I think social media gives us that place where we can share our stories, sometimes good, sometimes bad. As you were saying, the emotional evocation sometimes, especially as they're trying to draw you into, say, buy our supplement or here's my powder or whatever the case may be. It can have a negative outcome. And so I love the work that you're doing in the social media space, in the misinformation space. I'd love to just dive in on some of the topics that you've been looking into and sort of address how creators are speaking about it, or physicians for that matter, online, and then like what the science actually says. So, do you want to start with contraception?
Yeah. So, I have a couple studies on YouTube and TikTok about contraception. Currently, hormonal contraception is really demonized on social media, and there's a really interesting thing going on where Um, it's like on YouTube, 24% of the influencers were talking about discontinuing hormonal contraceptives, the number one reason to be more natural, and the second two reasons to lose weight and to improve mental health. There's a lot of misinformation about hormonal contraceptives. And I would say that sometimes the scientific and medical community is too quick to tell women that the side effects they're experiencing are misinformation
Hmm.
because sometimes bodies experience things differently. I will say though, there's some like nuance to that in that a lot of creators are talking about really rare side effects from contraception that you are highly unlikely to experience. And it just so happens this one person did and is talking very loudly online about it and scaring people.
Right. So, what's an example of something that they're, you know, blowing up social media on?
That you're gonna go on birth control, and then if you come off of it, you're gonna hate your spouse and you're no longer gonna be attracted to your partner.
Oh, yes, I've seen this.
Yeah.
My N of one is that I was fine both times when I tried to get pregnant. Okay, talking to you, what does the science say about that?
I haven't seen anything
Yeah.
about that. Like,
Yeah.
that has not been documented scientifically. Do we need to look into it? I mean, maybe we do if people really feel like this is happening. I will say there are some studies out there that do look into this and they try to make the claim, but they are limited, and it's kinda like, how do you establish cause and effect in that scenario? That's so hard, and so the research that people do point to it supporting the attraction piece is very flawed and should be interpreted with caution.
Right. That's like I go on birth control, I meet my boyfriend, get married, go off birth control, and all of a sudden I'm over it.
Yeah,
On to the next, we don't mesh. And like in my mind, especially with birth control, there are side effects. Like we can't skim over that. There are side effects for I would say the majority of women I know, but we, as we do with most things, we just kind of move on. We just get over it. We keep going. And I think what you're saying is, especially with like the Gen Z collective, which awesome as well, because they're advocating for their health in a way that we couldn't or haven't, at that age. And I think, asking those questions is really important, but it's also like there are other options to test out. There are other things like we don't need to villainize every single thing that is out there in the pharmaceutical world. Like there is the evidence based for that. There are, you know, anecdotal evidence that we can marry together and help women find like what that niche is for them specifically in their bodies. But yeah, I mean, telling someone that you're going to fucking hate your husband or your partner when you come off birth control, like stop.
yeah, yeah, it's crazy. And just because something doesn't work for you, like, doesn't mean that it's not gonna work for someone else.
Right.
Like, and it's just it's so anti-women, in my opinion, to
Yeah.
fearmonger about a medical intervention that could seriously change the lives of other women.
Do you take birth control now?
Yeah, 15 years.
Are you on the pill or you have an IUD? Pill, same one?
Yeah, never changed it, been on it for 15
And
years.
have you ever had side effects or have you felt any sort of way?
When I first started it, I felt nauseous for a month, and my mom freaked out because she thought I was pregnant, and I was like, "No, mom, I just started the pill. I'm not pregnant, I promise."
You're like,
Like,
chill out. I'm figuring this out. I
every
don't know about my body. I'm trying to figure it out.
I was like 15, and I was like, "No, I just started the pill. You just put me on the pill. Like, there's gonna be some, like, adjustments."
Yeah.
I will say that I don't get a period, and that is a big conversation on social media. "Oh, she doesn't get a period." I've had people say, like, "As a scientist, you should be ashamed of yourself that you're not worried about that." I'm like, "I'm not worried about it at all." I don't get a period. I haven't had one. I mean, maybe, like, once a year, maybe, like, throughout all this time. I'm not concerned about it. Sometimes birth control does that. It's different for different people's bodies.
Mhm.
And yeah, I haven't experienced any side effects aside from nausea when I first started taking it, but also, like, there's a possibility that there are side effects that I'm not aware of. I just don't notice them.
I have PMDD and on an IUD because it has that consistent dose of hormones and it works really well for me in just helping me manage my mood.
Mhm.
Whereas when I was on the pill, it was like all over the place. And for those of you who know me, I mean, I'm sorry if for sometimes it was like a little wild, but like the pill was not for me. It really like it's so much of trial and error. And I also say that from like, my love for the natural space as well. It's like if something has, no harm, no foul, meaning it's not a supplement where your dosages can get really high and you need to have, management of that. Like if it is like a topical something or, amazing skincare or beef tallow, everyone's up in arms about beef tallow. If you want to fucking use beef tallow, use it. You'll figure it out if you're going to break out or not. Like, why are you so pissed off about the beef tallow? I personally don't understand it.
I know. I know. Like, if it works for you, great. If it doesn't, great. Find something else.
Right.
Yeah, there's a lot of judgment around all of this. And I do feel like sometimes there's judgment from the medical community as well.
Hmm.
And that creates a further divide between us, especially when like we hear,
Interesting.
especially when we hear statements from the medical community about how like absolute ideas about how all natural, like naturopathic, all of that is bullshit. That pushes a lot of people away.
It
So
100% does. And in my opinion, it's not bullshit. But on both ends, you can have practitioners that are spewing bullshit. It can be a doctor talking about a study that had 13 participants. It could be, uh, you know, a naturopath who's trying to get you to buy into their blood work program for the year. But you have really good people, in my opinion, on both sides that you can look to who actually want to do collaborative care and want to learn from one another, which, what a novel idea.
yeah.
And I know that you've sort of you risk a lot of your career on social media to do to sort of meet women where they are, which is incredible. And it's such a shame that that's happening. So another topic that we've been talking about a lot is cycle syncing, which everyone's talking about. And for me, it doesn't work. And again, it's going back to where is the nuance, right? I'd love to hear what you're seeing in terms of the cycle syncing messaging and then what the science is saying.
So I did a study on what people on TikTok were saying about cycle syncing. Now, because research takes forever to publish, these data were from 2023. So they have really added a lot to the trend since then. But what we found was that they were making specific exercise and nutrition recommendations during each of the four menstrual cycle phases.
Mhm.
The interesting thing about the nutrition piece for me, and I'm not a medical professional, I'm not a dietitian, but I can read. And I have noticed that there are things that are recommended in the dietetics literature that are not consistent with some of the things cycle syncing recommends. And that interesting thing is we found that they were recommending different supplements for each week of the menstrual cycle phase. So the claim was during the menstrual cycle, when you're on your period, all women should be taking an iron supplement
Okay.
or eating like iron rich foods during that week,
Mhm.
which
Mhm.
again, I don't have a background in that. I don't know how much that holds up. What I have understood about supplements is that supplements are not something that we just take for a couple days and then the next week we switch to a different supplement and then the next week we switch to like that seems a little inconsistent with research.
Yeah.
Unless it's like, I mean, everybody's different, but and again, that's not my area, but that was the one thing that was a little bit alarming. It's the major issue is that they're saying all women on this phase of their menstrual cycle need to take this supplement.
Mhm. Mhm.
Like supplements are meant to fill gaps,
Yeah.
not to just be taken because you're in your luteal phase.
Right. And you don't know where your gaps are unless you're testing, and you need to test with a professional so that they can help you monitor where you're not just going in once a week. I mean, bless my husband, he does suckered into every single social media thing there is. And he does like the, D2C blood work things. And then he's just sort of left in the abyss with a bunch of supplements.
Yeah, that's overwhelming.
And I'm like, hi, let's talk. We
Yeah.
need to help you get on something that is consistent. And I think the word consistency comes to mind. It's like, again, going back to that craving that we have to be in control of our bodies is cycle syncing. It's like they're feeding us this answer of like on a silver platter, here's what to do to actually be in touch with your body to make sure you don't have cramps, to sort of still mask a lot of the shit that we shouldn't be masking. Like if you have really bad period cramps, something's wrong. Like you need to go to the doctor. You need to, like you did, try to get to the right person who actually will listen to you and help. And I think that you're definitely right. Where's the consistency in taking those supplements as it is? It's like if you just take it for 5 days, how is that actually affecting you and helping you?
Yeah, it's really interesting. I mean, I'd be if a dietitian came on and said that I was dead wrong, like I would certainly be open to hearing that person for sure. But it does seem odd and it's consistent with the fact that they're making inconsistent recommendations for exercise as well. And so, they'll say that there are nearly 2 weeks out of the month where you shouldn't be engaging in high intensity exercise or even weight training. And I read this interesting, I think it was a master's thesis or a doctoral dissertation, and they were talking about how why that this is so problematic because we know that women are more likely to suffer from osteoporosis.
Mhm. Mhm.
And if you're not consistently weight training or resistance training, you could be more at risk for osteoporosis. And I
Right.
thought that connection was interesting. I'm sure that some resistance training is better than none, even if it's 2 weeks out of the month. But It doesn't quite make sense. Also, like, women have been called the weaker sex physically for such a long period of time. So why would we only want to build strength 2 weeks out of the month?
Right, right. And realize no gains from that.
And like what I know from people in the physiology space, like consistency is what builds strength and muscle.
Hmm.
So
Hmm.
why would we want to be inconsistent about that?
It furthers us from our own intuition. Do you think? Like, as we are thinking about that, it's like, it's common sense. Like, if you're right, if you're lifting, you need to have consistency to, you know, get that progressive overload in your lifting. And if you're cutting out all of this time, you're not going to see any of that. As we need to start looking at more proactive health, that needs to be a part of the conversation. We can't just be doing these like band-aid solves. And to your point about the exercise, we've talked about this before as well. It's so individual. I mean, again, to go back to the PMDD thing, but in my luteal phase, if I don't do like hard ass workouts, if I'm not in the ring boxing, if I am not doing like a heated lift session, like getting it out, like my mood is not good. Like it is just, it sends me into a tailspin and I cannot, if I tested it out again, N of one, the last 2 cycles and it's not good.
Yeah,
So again, it's that trial and error. If it helps you get in tune your cycle and you're tracking it because you want to get pregnant or you just want to learn about your cycle, great. Track your cycle, figure it out, like see how you feel mood wise. If you want to eat in a different way and the nourishment makes you feel great, awesome. Like, I think it's just, if it makes you feel good, great, take it. But from to your point earlier, the black and white, the one size fits all, it's a no go.
it's a major no-go. Yeah. I
Yeah.
mean, I think about this with like even like going back to like cravings during your period, like they recommend like this is when you should have dark chocolate and like go into like feed into cravings and stuff like that. Like, never once in my life have I been on my period, which is very rare that I'm ever on my period because I started the pill so young.
Yeah.
Never once have I craved a certain food during that time. Like, that's just not how my body works. And so it's really not this like they make it a one size fits all and it's just not true.
Right. I'm also wondering like how that fuels just like body perception, our just the way we look at food in general for women is so can be such an issue with eating disorders and just a bad relationship with food. Like to me, it's like if you're limiting yourself in any way, if it's food groups, if it's just like keeping it restricted to one time frame, like having a good relationship with food. And that's something that we all should need to strive for, you know?
For sure.
So one other topic that I'd like to just get into in terms of like the social media, I guess like in that is sort of the what I eat in a day. Is that compelling for you right now? Like is that sort of a big topic or is there another misinformation trend that you prefer to talk about?
We can talk about what I eat in a day. I think that it's a complicated topic. My research doesn't match some of the other research out there. And I think a lot of people I will say that a lot of people push back on my research about what I eat in a day because they don't want to believe it, what we found, because it's so not what people think is going to happen. And so I'll explain what those findings are, but I would also add that when I post about my findings about what I eat in a day, the post goes absolutely nowhere. People don't care about it. They don't engage with that type of information. It's not appealing information when I post about it at all. Like, it'll get, like, 1,000 views and, like, 20 likes.
Because people don't want to hear about it or they just are like this feels like lighter content to me when I'm watching what I eat in a day with an influencer and it's more just like casual recipe content.
I have no idea. I
Yeah.
wish I I wish
Okay.
I knew why it didn't perform, but
Yeah.
my research, and it was on YouTube, What I Eat in a Days, found that, um, 90% were not about calorie counting. They're
Okay.
just it's not about calories. It's just
Yeah.
not. And the pushback I get is, "Well, the way you measured calories, they had to specifically mention calories or talk about it or list it in the caption." And so maybe they did have a low calorie meal and you just didn't capture it because you weren't looking at portion sizes and stuff like that. That's very possible, right? I may have totally missed that in the study because of the way we measured calories. But what we found, we analyzed the titles as well. What we found was that people were talking about realistic, what I eat in a day, like meals. Like they were using the word realistic, they were using the word like satiating, they were using the word feeling full, feeling good, feeling energized, feeling strong. Like that was the focus of the content.
So you think it's a positive message that people are getting an overwhelming positive feeling from this content versus I need to cut back or I need to strive to like fit into this small body or something like that.
We did an experiment. It recently just got a revision request from a journal, and we asked people to comment on the "What I Eat in a Day" video they saw, and there were 8 videos that anyone could have been randomized into in the experiment. And I think there were 2 out of 283 people in the study that left a negative comment. They were all like, "Wow, this is so inspiring. Good recipes. I'd love to try this. Looks yummy."
Yeah.
Like, I didn't tell them to write that. Like, they were in the lab watching the video, like, they could write whatever they wanted to. I mean, there probably was some bias. Like, people are less likely to be a troll in a controlled environment because the scientist is gonna read the response.
Right.
So there's definitely some, like, bias there, but they could have been honest and said something like, "This feels like disordered eating," or, "This doesn't seem like enough food," but that's not what the comments were.
That's so interesting. I mean, they probably are like me where they just save them all in their recipe tab on Instagram and then never make them, never
Yeah,
make the food or never go
probably.
back to it.
I do that too.
But it always it, like, gives me all the feels. I'm so excited to cook all of these recipes and, like, try this out, and I think I'm wondering if did you look at anything that was more specific with, like, conditions? I know a lot of women are saying, "Okay, here's what I eat in a day with PCOS or endo," or something like that, where it could include useful information for sure as sort of a starting point. But again, it's like going back to that message of where's your nuance? Like everyone's body's different. So like you can't just do that and expect it to heal your symptoms.
Yeah, that was actually one of the themes in the titles of the What I Eat in a Day videos. I mean, the theme was that they were qualifying who the meals were for, and it was really sweet. A lot of them were like, "What I eat in a day as a busy mom. What I
Well,
eat in a
I
day
have
as
to
an
watch that
athlete."
one.
Yeah, like, I mean, it was like, "What I eat in a day as an athlete. What I eat in a day as a college student. What I eat in a day as someone with PCOS." I mean, it was just people sharing what they eat. I do feel like we're primed by the media to think that these videos are awful and the worst thing ever, and that now I wanna be very clear, these videos are different from Skinny Talk, right? Skinny Talk was about, "Here's how you can be the skinniest possible version of yourself,"
Ugh, yeah.
and, like, really, really bad phrases and language, like, I would rather like, "No meal is worth it, skinny tastes better than any meal." Like,
That's
that's wild. That's separate from the What I Eat in a Day content. So I wanna be clear about that.
Yeah. It's so interesting because why do you think the media pushes us in that direction to think that what I eat in a day is negative?
'Cause there have been some studies that show that it is negative. There was an experiment saying that the low calorie depictions of low calorie what I eat in a day videos were associated with in greater intention to diet and poor perceptions of like self-image and body image. And that's all completely valid. I would just, my question is, well, what did the low calorie videos look like? And like, did you make them up or were they pulled from real social media?
Right.
Like, we can create stimuli however we like. Is it actually, like, what's happening? Because like, my content analysis work is showing that most of them are not talking about low calorie. So, like, it makes me question the experiment.
Mhm. Could I find that in the limitations section?
I don't know if they pointed it out.
Okay.
Hopefully they did. We're not always, like, as honest as we should be.
Great.
But yeah, it's a very, interesting, and this is a prime example of where researchers find different things and disagree on things. Now, I do also want to clarify that absolutely are these videos damaging for some people? Of course.
Mhm,
Like, of
mhm.
course they could make people feel sad or worthless or, well, I'm not eating like that, so I'm not as, like, balanced or as, like, in control as she is, or
I don't have
I
it together, like this person.
I
Yeah,
don't have it together,
yeah,
like, my
right.
life doesn't look like that, like, and I feel bad about myself. Like, does that happen? Yes, that's social comparison. But social comparison is not unique to what I eat in a day.
Right, right. That's a
Yeah,
whole other rabbit hole.
yeah.
Going back on just the sort of when you were saying like some doctors will maybe come at you for research or women in general, we can pit each other, we can pit ourselves against one another. And I guess my other question to you is, do you see a difference in the spread of misinformation with credentialed like MDs versus influencers, or is it sort of one and the same?
So we just did a study on TikToks about and Instagram posts about preeclampsia, and the difference was not significant, but there was a greater proportion of people who identified as healthcare providers spreading misinformation in comparison to influencers and health coaches.
What?
Yes, that was the finding.
So, okay, so what are they spreading specifically? Is it one study that got circulated and, that's sort of where it's going? Like, how does that happen?
None of the posts that we analyzed talked about specific studies.
Okay,
So it's not that. It had to deal with, or had to do with primarily recommendations for preventing preeclampsia.
got it. And do you know if any of the misinformation, like, could it be dangerous? Like the information that they're offering?
I don't know. I had a team of maternal fetal medicine specialists review it and characterize it as misinformation since that's not my area of expertise.
Yeah.
But I will say that some of the things that were in the, how to prevent preeclampsia were things like drink more water, or one person was like, if you eat 80 grams of protein per day, you can prevent preeclampsia. So it's
How much do you weigh? What are you already eating? I mean, please, dear God, how?
as if they're not drinking water and eating protein, as if they're not doing that. That's the issue with That's why people push back against the natural movement, because it's sometimes that group of people says things like, well, if you just eat and exercise and drink water, nothing bad will happen to you. And that's just not true.
Right. There's an underlying desire to get back to basics, and I don't think that, especially as women, we know how to do that. It's like, well, I have 30 supplements. I'm on birth control. I am trying to cycle sync myself to like the blood moon, and we don't know what's happening. And sometimes it's just like stripping it all away and starting fresh and like figuring out where you feel in your body. I mean, I have another podcast coming up with two gals that are in somatic exercise. And it's so interesting to me. And, maybe we'll have to have a collab talking about your hip and your body, because it's so interesting to me, like where we can actually feel in our body, like where we're storing tension, where the stress is, where from like our, lived experience in the past, like where we're storing that. But anyhow, I digress. One more sort of question, and then we can just go into like how we can advocate for ourselves is there one thing floating around on social media right now that you think is outright dangerous for women to hear?
Hmm. I'm drawing a blank. It's like the trends that I study, long term, maybe they could be dangerous. In the short term,
Yeah.
I'm not so sure. Cause the what I eat in a day, I couldn't think of anything there. Cycle syncing, like it could be dangerous in that you're not building muscle mass, but that's not like an immediate threat. You know what
Yeah.
I mean?
Sunscreen? Like,
The sunscreen thing, that's really interesting. That's a huge problem. I think that's dangerous for sure.
what do you think is most dangerous about the health communication that's coming out with it?
I mean, they're saying that sunscreen causes cancer. It's the sun that causes cancer. The sunscreen prevents it. That's wild to me that they're saying that. I am right now I'm working on an analysis of breast cancer videos, and one of the thing came up is that they're saying that the mammogram machine can cause breast cancer, which is interesting because you can't get screened. That's the tool we use to screen, a golden
Right.
tool we use to screen for breast cancer. And so, I'm not really well versed in that medical literature, but I think that that could be damaging if women don't go and get screened,
Right.
it'll be too late.
Right.
So I think
That's a major topic.
that's a threat. The other threat I'm seeing in the cervical cancer space, because I've done some pap smear work, is that women are talking about how you just shouldn't get a pap smear because it's too painful. And it's just, they call it girl horror vlog. And it's definitely an issue because if women aren't going and getting screened for cervical cancer,
Which
which is a treatable and preventable cancer, like, that's a problem, and then obviously, like, all of the vaccine stuff is a threat.
So I am not discounting anyone's pain in that arena. I'm wondering if part of that is providers talking them through what that procedure is. It's a quick swab. I'm wondering also, now that there is pain management available for IUDs, if that's also available, if that's something that they can ask their doctors for. And again, I don't know the answer to this, but maybe that's something that we can do to advocate and say, "Hey, is there pain management available for this?" If they in fact have experience in that before, because it is a very quick test. And to your point, I mean, that is life-saving.
It's life-saving. We found that videos on social media that include people talking about how to make pap smears more comfortable actually get significantly higher engagement. They're being saved. And so that's what women
Okay.
are looking for. They're looking for tips to make procedures and health appointments more comfortable.
Yeah.
Yeah.
All right, well, we're gonna have to dive into some of those tips. I'm gonna have to take a look at that because that is certainly something that every woman listening, you need to get your pap smear. It is like non-negotiable, but you have the tools. Like in yourself, you have the tools to navigate, figure out how to do it with less pain. We can go into that. One sort of moment to get your expertise on how women can continue to navigate and how they can apply your research to their own lives, like their daily life. What would you say is, as women are following you, experiencing your research, like how can they apply that to themselves?
Like my actual findings.
Actual findings, yeah.
I think that's kind of the area that I'm still getting into with my research. A
Mhm.
lot of my work is not practical. Like, as scientists, we're trained to be very theoretical, which
Yeah.
is always like translatable to the general public. So I think that, that's a question that I get all the time. I think that what I want to kind of get into and develop would be more health literacy skills for unpacking and of absorbing and interpreting the claims that we see in online environments.
Mhm.
I posted about this recently talking about how, why are you not someone makes a health claim, why are you not like checking their credentials? Why are you not googling them? Where do they work? If they're like a really like, valid expert source in
Mhm.
healthcare, their institutional affiliation will come right up. Like it's just a couple of extra steps
Mhm.
that you can do. And so I would like to do more work in making recommendations and providing resources for having higher health literacy in online environments.
So important. So important. If you were to say right now, like your top two after credentials, like are there 2 points that you think women right now, if they're on social media, they're like, okay, looked at the credentials. Are there two other points that maybe you can hammer home that we should be doing every day as we're sifting through this information?
Yeah, I mean, are they using like a lot of like cause and effect language and then like offering you a solution for purchase? That's a red flag. Are they using really extreme emotional storytelling? Are they I don't know. It varies. The tough thing is that it varies by the topic. I just I just wouldn't trust anyone who's like a health coach or an influencer. I just wouldn't. I don't know.
Or maybe not a doctor either, based on what you were saying about preeclampsia.
That's true.
So in my opinion, the net here is we have to do our own research, which is very loaded, which starts again with us. But I think evidence-based care, evidence-based information is more important now than it has ever been. But I do think that leaning into our lived experience, talking to other females, like the lost art of you're in the bathroom and you talk to a woman about something, even if it's like, I like your outfit, like something on a day to day basis. We're so missing that human connection as women and like bringing that to the outside, talking about what's going on with our bodies, like talking about HPV, miscarriages, like all these things that we've been socialized to feel like they're taboo. I think that helps us start to discern what is truth and what is not amongst all of this chaos. What do
For
you
sure.
think?
Yeah, I think those conversations are important. I also, just to go back to what we were saying, I would also add that, like, and this messaging does not work online at all. It does not work. But if you see something on social media that you want to try or you think would help improve, like you should probably talk to your doctor about it who knows your personal health history because it may not just because someone else did it doesn't mean it's compatible with your health history. Heavy weightlifting is recommended for women, right? We're seeing a lot of that, but it's not compatible with my hip surgery. Doesn't work for that recommendation doesn't apply to me. And so just moving through the digital space with the mindset of I am a unique person, not every recommendation applies to me because of my unique health history. I think that that's really important.
Yeah. And also reminding yourself, if you are indeed a female, that you are a female. And if they're talking to males, it's likely not going to be a solve for you.
That's yeah, depending on the situation.
Yeah. All right. I have a really quick fire round for you. And then we can tell folks where to find you. What's one wellness trend that you actually have leaned into on social media personally?
High protein diet.
Okay. What's like your favorite high protein snack?
So I'm like a major like carnivore meat eater. My husband is a hunter, and so we actually source all of the meat for all of our meals like from the backyard. It's about as organic as
Cool.
it gets. I know that hunting is like super controversial. It shouldn't be, but it is. And I mean, we source everything, like we source all of our vegetables and stuff from the garden as well. And so we try to eat like as organic as it can get. But I consume a lot of deer and venison and incorporate that into my meals. So
For
yeah,
you.
that's something very different about my background.
Awesome. Favorite personal care product? It could be makeup, it could be fashion brand, anything that you love or makes you feel good.
The Tula sunscreen, it's like the glow sunscreen.
I haven't
It's
tried that.
$30 on Amazon. I have it linked in my Amazon storefront for people that are looking for a favorite sunscreen. It's beautiful and I absolutely love it. I use it every day.
Does it give you like a dewy finish?
Yeah.
Oh, I love that. Love a dew.
Yeah.
What's the last thing you Googled or chat GPT'd or whatever?
It was to review my cover letter for a job I applied to this morning for typos. And it found a typo. Instead of saying that I'm a health communications scientist, I said I'm a health communications scientist. How embarrassing. I'm glad that I chat GPT'd that.
Awesome. AI for the win. A podcast, a book, a resource that you would like to recommend to women?
My books here are not good for that. They're like quantitative research methods. That's definitely not
Yeah.
it.
Not for me today, but perhaps a different day.
I really like it's by that podcast by Ariel Laurie.
Oh, the Well Pod. We love
Yeah,
the Well Pod.
I really like her. I think that she brings a lot of really interesting health experts from all different perspectives, and she has like really great questions and curiosity. So yeah, I like her stuff. I also love that she just comes across as kind of like a girl's girl as well.
Totally. Ariel, if you're listening, we're ready for you to do a swap. Um, so before we go, thank you so much. This is an awesome, raw conversation. You were so delightful. And I'm so excited that you will be joining me at our hard launch for GenWell this September in Boston. But where can people connect with you, find your research, all of that good stuff?
You can find all my studies and research on my Google Scholar. It's just scholar.google.com and then just enter my name. And I also have it linked on my Instagram. You can find me on Instagram as well. All of my stuff is linked in my bio.
Amazing. And as we are building generational wealth for women, what is a piece of advice that you would give to another woman to pay it forward, a younger woman?
I would say to prioritize yourself, and that prioritizing yourself and your health is not being selfish. It's actually being selfless so that you can be like the healthiest version of yourself. Like that's like the most important thing. Yeah.
I love it. Well, thank you so much. We're excited for all the new research coming out from you, and we're excited to have you back next time. Thank you.
Awesome. Thanks.
Bye.
Bye.